Hi, this is pharmacist Curtis Alexander. In this video, I'm going to talk to you about a drug called Vumerity, and this is kind of the 101 series where I give you an overview of the medication and something you can have as food for thought if you and your doctor are talking about it. Real quick, hit the like button, subscribe to the channel, and let me know in the comments if you have any other questions. So hopping right into it, Vumerity. It's also known as diroximyl fumarate, and I point that out because it's going to come, it'll make a little more sense as we get down here. But Vumerity is a drug, MS, so multiple sclerosis is what the drug is used for. And it can be used for different types of MS. There's relapse-remitting, there's clinically isolated, but it's an MS drug. Now, how does it work in the body? What makes it different? Well, it's actually a bit of an older class of drugs, an older idea of treating. But the truth is, we don't really know how it works. We believe it works by knocking down inflammation, which MS can be caused by inflammation because that lining around the neurons can get worn away, and then we start having some of those movement problems. So it's not really known, but the big takeaway here is its goal is to lower inflammation. Again, I mention this a lot. Drugs that are designed to lower inflammation. Inflammation is the yin and the yang in our bodies. It's good in the fact that it's involved in the immune response right away, but it's also bad when it gets out of hand, and we see that in other diseases like rheumatoid arthritis and psoriasis, those sorts of things. So drugs that address inflammation can cause side effects, particularly with our immune systems. And that's one of the things we'll talk about here in a second. A very interesting point about Vumerity is it's a prodrug. And so what that means is that in our bodies, a prodrug is taken, or in this case taken, and then it's broken down by our bodies into an active metabolite. Now, there's another drug out there on the market. There's actually two, but the other one that's important to note is Tecfidera, which is another MS drug, which is another prodrug, and they're both broken down to an active drug. I think it's monomethyl fumarate. The generic is escaping me, but there was just a new drug approved that has the active compound in it. That's what it is. You don't have to use the prodrug, and the new drug is Vumerity. So I point that out because what sense does it make to have a prodrug? Why don't I just go with this new drug that's the final product? And that remains to be seen if it's going to be worthwhile, because the idea behind it was, well, we'll skip these prodrugs and just go with the end product, and we'll have less of a dose burden to take, and we should have decreased side effects. Right now, that does not appear to be the case, but it's early. So right now, the Vumerity and the Tecfidera seem to be on par with this new one that came out, but another video for another time. The important thing is it's broken down to an active ingredient, and to do that we have a starter dose and a maintenance dose. The starter dose is going to be, and I want to point out these are capsules. This is not an injection. So as a starter dose, we're going to have 231 milligram capsules, and those are going to be taken twice a day for 7 days. And then once you hit that 7-day mark, then you bump the dose up, and that dose then becomes 2 of those for 462 milligrams twice a day. And that's then the maintenance dose. I did get a question, is Vumerity designed to be an immunosuppressant? And it's not immunosuppressant, it's really a side effect of the medication, is that it can lower your immune system, but that's not why it's taken. Okay, so now moving into the side effects, we talked about the inflammation. If you're trying to address inflammation, you're also hitting the immune system, one of the natural things it does. So you do see problems with the immune system. And infection rates with Vumerity and Tecfidera and the new one, the Vumerity, that's what I was saying. Right now, the side effect profile for all of them are about the same. 60% infection rate up to, doesn't mean 6 out of 10 it will happen to, just means up to that point can get infections. When you first start taking Vumerity, You may experience flushing. What they found is you can give somebody up to 325 milligrams of aspirin, as long as it's not enteric coated, just plain aspirin, before the dose can help with that. Of course, you have to make sure there's no allergies, stomach issues to be taking the aspirin, but that does help. And the other side effect that happens in a fair amount of people, or can happen in a fair amount of people, is GI side effects. That can range anywhere from stomach pain to diarrhea to nausea. So definitely a class of drugs that is not without the potential for a decent amount of side effects, but people who have these forms of multiple sclerosis are in a tough position. So the risk versus reward is going to have to be decided between you and your doctor. The last thing I want to note about Vumerity is it caught a lot of heat when it came to the market because the price, the cash price, is astronomically high. It's they said $88,000 a year. I'm going to provide you a link to the Quick Start program. In almost all cases, it's not anywhere near that. There is financial help for these newer medications that are very high dollar. Usually this is going to be covered by your insurance, but again, that varies. But I'm just pointing out that there are options available from the drug company, from your insurance, to deal with some of these things. So again, Curtis Alexander, thumbs up, subscribe to the channel, let me know in the comments how I'm doing. And this is Vumerity, so if you have any questions, let me know in the comments, but I appreciate you listening, and until the next video, thanks.